A 68-year-old client arrives to the emergency department with sudden right-sided weakness and slurred speech. Symptoms began 90 minutes ago. Blood pressure is 182 over 102, heart rate is 96, respirations are 20, O2 sat is 96% on room air. The client is alert but confused. CT scan is pending. The current meds this patient is taking are warfarin, lisinopril, and atorvastatin. Which provider order should the nurse question? A. Give IV labetalol to lower blood pressure. B. Draw stat, PT-INR. C. Prepare alteplase administration. Or D. Place the client on continuous cardiac monitoring. So let's break this down. Weakness on one side of the body is a classic stroke sign. So is slurred speech. Symptoms also happening suddenly is what makes this a high probability that a stroke is what is happening. Stroke symptoms are always treated as an emergency. So before we know anything else, the patient's symptoms alone make us think that we need to rule out a stroke. There are two major stroke types. There are ischemic strokes, which is a blood clot that blocks blood flow. Brain tissue is deprived of oxygen in this situation, so the treatment for this would be some kind of clot busting agent such as TPA. Then you have a hemorrhagic stroke. That is bleeding, so a blood vessel bursts and bleeds into the brain. So the treatment for this would be to stop the bleeding, lower the blood pressure, and you would never give TPA to one of these patients. TPA is a clot buster. It dissolves clots. That is great for ischemic stroke, breaking up that clot, but deadly for hemorrhagic stroke. This is why the nurse cannot jump ahead and prepare TPA until the CT scan shows exactly which type of stroke we're dealing with. So the correct answer for this question is C. Let me know in the comments if you got it right.